Hello guys, welcome to the next session, which is about the national health missions in the PSM. Let me know in the chat box once as I am clearly audible and visible to you. Am I clearly audible and clearly visible to you? Just about the yeah, I think it's perfect. Okay, right? So we have to talk about it. Like, guys, please understand this is a very important topic as per the PSM subject, right? And always in your exams they're asking you about this such missions, all right? So we have to talk about this missions in a brief with their logos, what their aims, and when they initiated, and which is the main target of such missions, right? So we have to talk about this all this stuff. uh, just let me know in the chat box it's audible and clearly visible. We'll start this session, right? So this is a very important topic, and always coming in your exams, right? So we have to talk about one by one, and I'm trying to very simplifying this topic uh, for you guys, so it will be easy to understand and remembering the things. Okay, right? Okay, so starting with the first one, which is known as your National Health Mission 2030. Now, what is the thing is, please remember this logo. What you are seeing in this logo, this clearly name is written here, National Health Mission. Yes, the name is clearly mentioned here, National Health Mission. And what you are seeing in this image, one male person is there, one female is there, and one child is there. And in Hindi, they written Rashtriya Swasthya Mission. You have to remember Rashtriya Swasthya Mission. Please remember, they will not give you, if they are asking you the image based MCQ, they will not give you this written image. Okay, they will not give you this written image, they will give you this inner one, a red color one logo, just they will be gonna mention it, right? So now, what is the meaning of this National Health Mission 2013? This is a combined with the National Rural Health Mission and National Urban Health Mission. So this is the combination of the both of it. National Rural Health Mission we are having such as the which is running in the rural area of India, and although we are having some national urban health missions which are running in urban areas, right? So for the combination of this both, thus the combination of this both is in the your national health mission, is in your national health mission, all right? And if we're talking about it, yes, so this is by the Ministry of Health and Family Welfares, right? Which is by the Government of India. So this is run by the ministry. If they are asking about the ministry which is running, yes, please remember this is the combination of National Rural Health Mission and National Urban Health Mission. Both are combined together as a known as National Health Missions. And this is run by or the managed by the ministry which is by the Health and Family Welfare. It's included it's included all other health programs like your all our other program which is like RMCHA and PBVC and TP and LEP, right? And DP, all are will be coming under this. All are coming under this national health program. This all are coming in under into your national health program. And just remember what is the main target, what is the major targets of the what is the major targets of our national health mission. This is the very important, right? So what are the main target? There are the three important targets are there. The first target is that there will be the maternal mortality rate, MMR. Maternal mortality rate will be less than 100 per lakh labor. Currently, if we are talking about it, currently it is running 113 per lakh, right? Live birth per lakh live birth. But there is a what is the major target? This is a major target by the National Health Mission 2013 that we have to decrease it more decreases, which should be now coming at the less than 100, less than 100. Then there will be the second is the your IMR should be less than, right? Infant mortality rate should be less than 25 per thousand live births, which is currently your 32, which is your 32 per thousand live birth, right? And the last one, which is your third target, it is your total fertility rate 2.1, right? And which is currently going on the 2.2. And please remember, so the CPR should be set more than 60 and NRR will be shall be the one. Then only can your total fertility rate will become into your 2 is 2.1, right? Currently it's 2 is to 1. So there is the three major targets by this National Health Mission. What are those three, guys? Please remember this. First, maternal mortality rate should be less than 100 per lakh live births, right? Currently 113 is their values. And the second one is their infant mortality rate should be less than 25 per thousand, which is currently 32 per thousand, 32 per thousand child live births. And the last one, which is the total fertility rate. In the total fertility rate, we have the 2.1, right? Our target is the 2.1, but currently it's running on the 2.2. So this is all about your National Health Mission 2013, right? I hope you understand about it very well, right? Moving forward for the next one, which is known as Ayushman Bharat Program 2018, which is known as your Ayushman Bharat program. And please remember, this is also known as your Pradhan Mantri Jan Arogya Yojana, which is also short name is the PMJ, PMJ, Pradhan Mantri Jan Arogya Yojana. And by the name only, you can understand by the logo here that this is clearly in the Hindi. They mentioned the very well Pradhan Mantri Jan Arogya Yojana. Also, they mentioned the word Ayushman Bharat, which is the name of the program, Although the short form of Pradhan Mantri Jan Dhan Yojana is your PMJ. So they mentioned in the logo PMJ also. So they mentioned this all the things. So now, what is the main uh, purpose of this Ayushman Bharat program? Just understand. This will be provides you the. Please understand. This will be going to provide you the cover of 5 lakh rupees per family per annum per family per annum for the secondary and the tertiary care across the public and the private implant hospitals, right? So it is for the health, you can say this is the having the health benefits. This is for the health benefits, and it's provided the 5 lakh up to the 5 lakh rupees it is covering per family per annum it is covering, right? Which is in the only and only, please understand, on the secondary and the tertiary care, not in the primary care, and by this only you can understand they mentioned here the 5 leaves. Yes, they given you the 5 leaves here, right? So it's giving this 5 leaves are, you will remember, with this 5 leaves there is the totally 5 lakh rupees, 5 lakh rupees, right? And this is the main important, this is going to cover more than 50 crore population in BPL. So it's covering the more than the 50 crore persons of the BPL. And it's some news other national health protection schemes also, right? And the one is here, which is the 1.5 lakh plus health that is included in this yojana, in this program. There is a 1.5 lakh plus health and wellness centers are will be established under this Ayushman Bharat program, right? So this is all about our Pradhan Mantri Jan Dhan Yojana, right, by the name, and this is the name also known as the Ayushman Bharat program 2018. Just remember the important thing, they will ask you how much is the coverage. Yes, it provides the cover up to the 5 lakh rupees per family per annum, right? Okay, should we move forward? Please remember the logos are very important. How you will remember this logo? They will not give you written this names, Ayushman Bharat, PMJ, or the Pradhan Mantri Jan Dhan Yojana, just you have to see there are the 5 leaves are there. 5 leaves are there. So you have to remember with this 5 leaves and this person. Okay, right? Should we move forward? Yeah. The next, the next is known as very important, which is known as National Tuberculosis Elimination Program. Yes, this is known as your National Tuberculosis Elimination Program. And you can see here the logo. You can see here the logo. In the logo only, they mentioned the name National Tuberculosis Elimination of the program. And given two more things, you can see this is the one person is there and shown in the image. They shown the lungs, right? As the tuberculosis is a respiratory disease, so they mentioned they shown the lungs in the logo, and they also mentioned here the TB harega, देश जीतेगा, TB हारेगा, देश जीतेगा, and they given the tricolor, the tricolor here, which is your orange, white, and green. Orange, white, and green. Right? You can see the Kesaria, white and green. Right? And they written there TB Mukt Bharat. Yes, this tricolor of our flag, right? Our Indian flag is having the tricolor. So this tricolor is given in this logo and written clearly that TB Mukt Bharat, right? So this is the National Tuberculosis Elimination Program, right? And this is, please remember, it is a new name of which is the revised National Tuberculosis. The earlier the name was the revised National Tuberculosis Control Program, which is known as your RNTCP. RNTCP. So this is the new name of, it's just a new name, right? The same program is there, but just given as a new name with a new logo. They given the new logo. So you have to remember this logo, National Tuberculosis Elimination Program. Elimination Program, right? So in this, please remember this yellow color circle will be there. One red color person is there. The lungs is mentioned here. You can see in the logo they mentioned the lungs. Although this is the tricolor of the our Indian flag is given and clearly written that TB Mukt Bharat. TB Mukt Bharat will be written here, and the main slogan of this program is the TB Harega, Desh Jitega. TB Harega, Desh Jitega. And in this, we have the category 1 and the category 2 are treated with the same regimen of HRZD. You already know from your medicine subject about your anti-tuberculosis drug and from the pharmacology, right? And for the 2 month, which is also known as your intensive phase, yes, this is known as your intensive phase. And for the next your HRE, which is for your 4 month, which is known as the continuous phase. And the totally there is the 6 month, the 6 month course is given for the tuberculosis, right? So this is the case, this is the image of your National Tuberculosis Elimination Program. Just remember the category 1 and the category 2 is treated in this the same regimen only, right? 2 months, which is your intensive phase will be here, and the next 4 months will be your continuous phase. I hope about the anti-tuberculosis drugs you studied well in your pharmacology and the medicine subject. The next is your direct observed treatment. Directly observed treatment short course, which is also known as your DOTS, which is also known as your dots. So what is this dots? What is this dots? Please understand. By this image, you can see there's a person is here. The dots are written here, and the slogan of this program is the Pura course Pakka Ilaj. Pura course. You can see here. Pura course Pakka Ilaj. Yes, and this is the ITC based adherent support of the dot 99. Dot 99. And in this dot in this dot there's the intensities, the incentives for the per patient should be given 500 per month. 500 should be given per month. 500 should be given per month. And the chest x-ray and the CBNR test in the diagnosis of the patient is the used as the diagnosis of the patient. And this is the daily regimen. This is the for the given as a daily regimen and fixed dose combination. The combined drug should be given in these cases. in this pack of this dot 99, you can say, or the dots, what is given? There is a combination of their anti-tuberculosis drug. This is that all combination of your all the anti-tuberculosis drug in a fixed dose should be given in this regimen, right? And the daily regimen, so the patient should have to take the daily this medicine, should take the daily this medicine. And that's why this is the active case finding is used also. And in this we are using the drug resistant TB treatment also, all right? And right, so this is about also this is also for this your tuberculosis only, for the TB only, right? So this is for your dots is also for your tuberculosis. So one we saw, this is about your national tuberculosis elimination program. This is also for your TB, please remember. And your diet observed treatment short course, it's also dots is also by your for the TB. Please remember they asked you earlier the what about the incentive for the patient. Yes, the patient should will get in this course, in this short course, the patient will get the 500 per month. So as we already talked about it, it is a 6 month total duration of this treatment is the 6 month. So the patient will get the 500 rupees per month as he is treated with this. All right, please remember this. All right, okay. Should we move forward? Please remember the logo. Please remember this logo of the dots. The next we have to talk about. The next we have to talk about the. Just a minute. So the next we have to talk about the next share. So next we have to talk about, just a minute guys. I think there was any error. I think now it's clearly visible to you. Yes, okay, right. So now we are talking about the next is known as your next share. This is known as your next share, right? Next share. By the name you can see in this logo only they given the Nikshay. They given in the logo already they written the Nikshay word clearly, and it is a mobile base. The logo is showing that it is a something as a mobile base. So what is this? What is this? This is an online tool for the monitoring and the surveillance of the TB control, right? So this is a mobile base. Again, this is also for the TB. So we talked about the TB till now, three courses, the three program. First is the National Tuberculosis Elimination Program. The second is about the DOTS, and then the third we are talking about the NICSHARE. NICSHARE. We are talking about the NICSHARE. So this is the online tool for the monitoring the TB control program, and the word is combination of the two Hindi words by the name. You can see what are those in the words. The first is the ni, and the second one is the kshay. And the meaning of this words are the eradication of tuberculosis. If I'm talking about this combination of this word, so what they are meaning? Yes, they are meaning for the eradication of the tuberculosis. And this is the online tool. Please understand, this is the online tool. So that's why they're given you the image. In the image only, they're given you the mobile phone with the logo. They're giving you the mobile phone with the logo. So this is about the Nikshay, and this is also for the doctors also. They are registering the patient. They are registering the new diagnosed the tuberculosis cases. They are mentioning on the this portal only. So this is for the Nikshay. This is about your Nikshay, right? Sure. Should we move forward? Yes. Moving forward for the next one, which is important. This is your integrated child development services 1975, right? ICDS, you can say the short form of this also. This is your ICDS. Yes, this is your integrated child development services. By the logo only you can see, this is the mother, and this is the child is in the lap of the mother, right? So this is your integrated Child Development Services of the 1975. And if we're talking about the heart of ICDs, what is the hearts of the ICDs? Many times this question asked in the exams. So the hearts of the ICDs is your Anganwadi, right? So if they're asking you what is the heart of ICD. So, what is the heart of the Integrated Child Development Services? Yes, this is your Anganwadi. This is your about your Anganwadi, and this Integrated Child Development Services are coming into your Ministry of this coming under into your Ministry of Women and Child Development of Government of India. Government of India. So, as this is run by the Women and the Child Development of the Government of India. If we're talking about the functional unit, what is the functional unit? Yes, in the functional unit under this mission, there's the community development block. There's a community development block, right? And one community development block. What is happening here? Please understand. One community development block is having the 100 villages under this block. So what is having? There will be the one community block. This is a very big block is there. In under this block, what we are having under this block, we are having the 100 villages. Near the 1 lakh population is covered by this one community block, one community development block, right? And if we're talking about the one Anganwadi center, if we're talking about the one Anganwadi center, so yes, it's per 300 to 800 population in the hilly area, and there is a 400 to 800 population in the plain areas. Please remember, this is a question they are asking the repeatedly in your exams about the one Anganwadi center. So please remember, one Anganwadi center on the hilly area, there will be the 300 to 800 population will be covered by this one Anganwadi center. The secondly, in the plain area, there is the 400 to 800 population will be covered in a plain area, in the plain area. And please remember, they're asking again and again this about the Anganwadi. So they can ask you this time about this community block. So in the one community block, how many villages? Yes, there is 100 villages are going to cover in this community development block near the 1 lakh population. And also, I'm mentioning here, I'm mentioning here, this is the very important MCQ, that what is the heart of your ICD? What is the your heart of integrated child development services, right? So this is Anganwadi is the heart of the Anganwadi is the heart of your ICDS, right? So I hope you understand about this ICDS also, right? I hope you understand about this ICDS also. Now we have to talk about the next things. What is this next things? These are such instruments which is used in the measurement. The first is your infantometer. What is this infantometer? You can see here, this is used to measure the length. So this is the used to measure the length of the child. So the child will be lying down on this infantometer, and this will be the adjusting. This will be the adjusting will be there, and with this adjuster will got the values of the length of the child, the length of the child. And please remember, only and only the infantometer should be used up to your 2 years of the child, 2 years of the child. This is used for the infantometer. Please remember the image. They can ask you this by the image based MCQ. They can ask you this by the image based MCQs, right? So this is about your infantometer. This is about your infantometer. Talking about the next, this is your stellate scale. What is this your stellate scale? This stellate scale is also used to measurement the weight in the ICD's activity, which we talked about just now. About we talked about the integrated child development and child development skills, right? So about this services only, if you want the child measurement of the child weight, so the measuring the weight, you can see here this kettle scale. You can see there is a dial of this weight machine, and this is the dial of the weight machine, and here we are having this straps. We are having this straps where the child can be put it on this straps, and we are getting the weight of the child from this kettle scale. So for the infantometer may use for the measurement of the length up to the 2 years. The next we have the settle scales, and this settle scales we are measuring the weight of the child, Please remember about it. We are using this for the weight of the child, in the ICD's activities. And this is the very important thing. I hope you studied this in your pediatric subject also, and in the PSM you have the both in this, and this is known as your Shakir's tapes. This is known as your Shakir's tape. What is the use of this Shakir's tape? Yes, this is used to measure your mid-arm circumflex. Yes, so this Shakir tapes is here. So for this, using this, what we are using? We are using to measure this tape to measurement of the mid arm circumflex on the filled by the health workers, exactly. So for this, the for the mid arm circumflex, right, for the Shakir tape. And what is the targeted age groups here? What are the targeted age groups here for the Shakir tapes? Yes, we are using the Shakir tapes from the 6 month to the 5 year of the child. Please remember, this Shakir tapes is used for the measurement of the, we are measuring from here the mid-arm circumflex. And for using this, do you have the age group? What is the age group of it? Yes, this is the age group from the 6 months to 5 years. And what we are getting from this? Yes, we are getting for this about the nutrition of the patient. And in the severe malnutrition, if the child is having the severe malnutrition, it will come under the red color zone. And what is the red color zone is saying? Yes, the red color zone is saying your mid-arm circumflex is less than 11.5, less than 11.5. So you can see by this image also, I'm showing you again, we have a green color markings here on this strip, we have yellow color markings on this strip, and we have the red color marking of this strap. And as we are getting with this strap only, as we are getting our mid arm circumflex of the child, what we are seeing, we are seeing if the child is on the green color, the child is healthy. But if the child is on the yellow zone, we are getting that child is the malnourished. And if the child is coming into your red color, if the child is coming in your red color zone or the red zone, this red zone is giving us the for the identification for the severe malnutrition. And in the severe malnutrition, what we are getting, the mid-arm circumflex, yes, it should be your 11.5, right? Yes, the yellow one is also known as, your moderate one, right? Moderate one. Red is your severe, and the yellow is your moderate malnutrition, right? Green is the safe zone. The green is your safe zone. So there's three important instruments you have to remember in your PSM subject, right? So infantometer for the measuring the length of the child up to the 2 years. Then we have the Sattel scale. This is used to the measure for the weight of the child. The third is your Shakir's tape. The Shakir's tape is used for the mid-arm circumflex, for measuring the mid-arm circumflex. Please remember, this is your image-based MCQ. Image-based question, right? So they can directly give you the image and they can ask you, what is this? This is your Shakir's tape. This is your Shakir's tape. Now I'm moving forward for the next one. We have the ICDs. As we talked about this is the Integrated Child Development Services. So this Integrated Child Development Services is having the growth charts. So this is for the growth charts, and this is used to assess, please understand, this is used to assess the malnourished in the child, right? So this is coming into your Integrated Child Development Services only. It is under in this only, and this is your ICD chart. What is this ICD chart? We have to talk about it. So there's a two type of the charts you can see here. The first one, which is for the weight for age, about for this pink color one is for the girls, and this is your WHO growth chart. This is your WHO growth chart is given, right? And with this, the two charts you are seeing the more. This one is the pink color. The second one is here. You can see this the blue color one chart. So the pink color one chart is used for your girls, and the blue color chart is used for the boys. Blue color chart is used for the boys. So this is the two differentiation chart. And what is the use of this chart? Please understand, this is the URC, which is your our 50 percentile for the boys, and the LRC is for the third percentile for the girls. And we have the different zones in this different zones in this chart. You can see there's a green zone is there, yellow zone, and the red zone. And this green zone is also known as road to health, road to health, right? So this is the ICD. This, you can say, the ICD is growth chart. And with this we are measuring the about the assessing for the malnourishment, right? Malnutrition. So we are using for the malnutrition only, right? So there's the two charts, which is the very important. By the image, you have to identify this growth chart. You image by this image, you have to identify this growth chart. Okay, all right. The next is here the image, which is the very important image. And what is this image? Yes, what is this image? This is your Herpendine. This is your Herpendine calipers. And this Herpendine caliper, please understand, this is your Herpendine caliper is used for the measurement of the skin fold. Measurement of the skin fold. I think this is not visible to you. Just a minute. I'm trying to show you this. Perfect. Right? I hope now it's clearly visible to you. Right? Okay. Right? So this is Herpendine caliper, and this is measurement of the skin fold thickness. We are using for this for the used for the measuring of the skin fold thickness. We are using for the skin fold thickness. By the image you can see here, by the image only you can see here what you are seeing. What you are seeing, there is a skin fold in the child, skin fold of the child's skin. And this is measuring. What we are doing, we are measuring by this Herpendine caliper, we are measuring this thickness of the fold. You can see this is the dial. So this dial will give us the value. This dial will be gonna give us the value. And this is the thickness of the skin fold. This is the thickness of the skin fold. As this is already asked 2 to 3 times in your exam, so they can ask you again also. They are asking you again this also for this, right? So please remember this. Please remember this very well, right? Should we move forward? Right? Very good. Next, moving forward, for the next is your mission is known as your Poshan Abhiyan. And in this portion Abhiyan, we are seeing in the logo. In the logo, there is a clearly mentioned the Poshan Abhiyan, and this is the PM's overarching scheme for the holistic nourishment. And they given the slogan of this Abhiyan that Sahi Poshan Desh Roshan. What is the given the slogan by for this particular mission? They given the slogan Sahi Poshan Desh Roshan, Sahi Poshan, Desh Roshan. And you can see it's looking like a leaf is getting out. The green color one person is there, and orange one is also the person is here. And please remember, it is a multi-ministerial coverage mission. All right, this is the multi-ministerial. It means that more than two ministries are working with this on this Poshan Abhiyan. And with this mission, the vision is to ensure the attainment of the malnutrition free India by the 2022, by the 2020. So what is this the main mission of this program? Yes, the mission of this program is the attainment of the malnutrition free India by the 2022, achieving this by the 2022. And this is also under the ministry of women and child development. Women and the child development. If you're talking about this, how it's going on, so this portion Abhiyan is run through the Anganwadi centers, so this is going to provide the nutrition products, right, to the childs, right, to the childs to avoid this malnutrition, right? So this is run through by your Anganwadi Center. Just remember the slogan and about this vision of this. This is the vision for the making the malnourished free India by the 2022. By the 2022. And what is the main scheme of it? What is the main center of it? Which through this Poshan Abhiyan is going to running over on? Yes, this is run by your Anganwadi centers only. This is run by your Anganwadi center only, right? The next one, which is the more and more important, they can ask you this time, which is your midday meal scheme. This is known as your midday meal scheme, and you can see here that school childs are sitting in together in a like a row, and this is having a food plates in front of this childs. And clearly the slogan is written here, midday meal scheme. The name of the scheme is clearly mentioned here. And this midday meal scheme is run by your Ministry of Human Resources and Development. Human Resources and the Development. It's also now known as Ministry of Education. Ministry of Education, right? So this is the midday meal scheme, which is run by your Human Resources and the Development, Ministry of the Human Resources and Development, which is also nowadays now it's known as Ministry of Education, right? What is the target? Please understand what is the target of this midday meal. They have to provide the one third of the calories and the one half of the proteins in a provided in a dietary, right? Regular dietary assessment. They have to provide this. And how they are providing it? Yes, so they are providing the 100 gram and the 150 gram of the clears to the primary and the upper primary children, which is provided respectively, right? So what do you mean of midday meal? Yes, in the school going children, in the break of the school, in the break in the when they are getting in the break in the schools, they are providing this one third of the calories and the one half of the proteins. So 100 to 150 grams of the clears are provided to the for the primary and the upper primary children's, right? Provided the respectively to the them, so they will not get the not this, so for providing this for the nourishment only, right? Nutrition one only, right? So this is your midday meal scheme. The important is the logo. Please remember the logo. Don't forget this logo. Very important logo. They can ask you is the image based also. They can ask you as a this image based logo. We are talking about the next is about the National Family Planning Program. And please understand, this logo has been set to use for the National Family Planning Program. And what is the logo is saying? Please understand, in the logo you are saying there is a red color triangle is there. One male is here and the female is here, and they are having the lap, they are having a child. And what is the slogan of this particular program? The slogan of this particular program is the जोड़ी जिम्मेदार जो प्लान करे परिवार. Yes, so what is the slogan of this National Family Planning Program? So the National Family Planning Program is for the slogan is the जोड़ी जिम्मेदार जो प्लान करे परिवार. And what is this? Yes, so this is for the eligible couples. This program is run by for the eligible couples for the doing the national family planning, for the family planning. So in the every CSC and the PSC, there's a special special separate sections are there for the family planning. So they are giving you about the family planning. They are giving you suggestions about your family planning, and this is the logo of your National Family Planning Program. This is the logo of your National Family Planning Program. All right, right. Should we move forward? Yes. So the next is your Janani Sishu Suraksha Karyagram. By the name only you can understand. Janani, it means the mother, right? Shishu, it means the child who is getting the born. So the mother and the child, the both will be getting Suraksha. It means they will get the safety. So this is known as the Janani Shishu Suraksha Karyagram. Janani Shishu Suraksha Karyagram. And what is the target of this particular program? What is the main target of this particular program? There is the free diagnostic. Please understand what is the main aim of this program. There is a providing the free diagnostic, free drugs, free delivery, free diet, and the free blood transfusions. Free delivery are the components. Free delivery are the components, right? So this is all is given by this program, right? So this curriculum, and you can see the logo. There is the mother, which is the Janani, and the Shishu. It is the child, newborn child is your Shishu, right? So both are given in the logo, and they clearly mention the name of this program, Janani Shishu Suraksha Karikram. Janani Shishu Suraksha Karikram. What is the target? And please remember the aims are the very important. They are aiming for the free diagnostics, free drugs, free delivery, free diet, free blood transfusion, and the free delivery or components are components. And under this Janani Shishu Suraksha Karikram, we are having four important things. What are those four important things? The first thing is the newborn care corner. So what they created? Yes, this curriculum is run that there should be a separate newborn care corner should be in the hospitals. In the hospitals. The second thing, there should be the newborn stabilization unit should be there. There is a newborn care corner should be there. There should be the newborn stabilization unit should be there. And the third thing is there which should be the special newborn care unit. There should be the special newborn care unit should be there. And the last one, which is your fourth one, that is your home-based newborn care. Home-based newborn care. So there's four important things which is coming under this your Janani Shishu Suraksha Karikram. What are the four things? Newborn care corner should be there. There should be the newborn stabilization unit, special newborn care unit, and the home-based newborn care. Home-based newborn care. I hope you will remember the logo of this particular program. I hope you will remember this particular logo of this particular program. All right, this is your Janani Sishu Suraksha Karikram. Next, we have the National Vector-Borne Disease Control Program. So by the name you understand, yes, which disease are the vector borne. It means they are transmitted through the vectors, right? So we have to making control on this diseases. This is coming under this program. And also this is short form is known as your NVBDCP, right? National Vector Borne Disease Control Program. What is the most common vector borne disease? These are the important one-liner MCQs. What are the most common vector-borne disease? Yes, this is your most common vector-borne disease is your malaria. If they're asking you this question in a one-liner, what is the most common vector-borne disease? Your answer should be the malaria. If they're asking you which is the most common viral vector-borne disease, so that should be your dengue. That should be your dengue. And the last one, what is the most common arboviral vector-borne disease? That should be also your dengue. That should be will be also your dengue. So you have to remember this all the three. You have to remember this all the three one-liner the exam related to this particular program. Related to this particular program. By the image, what we are seeing, by the logo image, what we are seeing, there is a family child. One child is there, and one male female couple is there, and this is covered by a layer. On this layer we are seeing the mosquito. What we are seeing, but it is covered by a layer which is the controlling program layer, and above this logo we are seeing a mosquito. We are seeing a mosquito there, right? And so this is known as your National Vector Janit Rog Niyantran Karikram, NVBDCP. All right, so remember this logo. What is there? One family is there, and above this family you have to see this vector. What is the vector? Yes, your vector is your mosquito. So this mosquito is presented in the logo. Please remember what is this? This is your National Vector-Borne Disease Control Program. Disease Control Program. Right? Should we move forward? Yes. So this program, right? What is in this program? This program is including the diseases like malaria, dengue, filariasis, kala ajar, Japanese encephalitis, and the and the CG fevers, right? So this all the coming into under this program, as this all disease are your vector borne diseases. These are all your vector borne disease. So they are covering in this program, under this program only, under this program only, right? So please remember the logo of this program, very important. This is a very important logo. And remember this three important MCQ, right? Most common vector-borne disease is your malaria, and most common viral vector-borne or the arboviral. The both are your dengue only, right? Moving forward for the next one, this is the logo. And what is this logo? Yes, this is the logo of your National Leprosy Elimination Program. NLEP, National Leprosy Elimination Program, NLEP. And what we are having this in this particular National Leprosy Elimination Program, you can see this is the logo. There's a rose, the flower is in the hand of the person, and there's the petals of it. This is the particular logo of your NLP. Please remember, is the logo of National Leprosy Elimination Program, right? And this is the uniform multi-drug therapy for the all patients. The three drug regimen like your dapsone, rifampicin, and the clofazimine. Clofazimine. So this is the three drug regimen under this program. So this is giving you the uniformly multi-drug therapy, And what is in this multi-drug therapy? Yes, we are having in this multi-drug therapy, we are seeing the importantly three drugs regimen, right? Dapsone, rifampicin, and the clofazimine. Also, we have the Nicust. What by this Nicust? Please understand, as we talked about the Nikshe. What was the Nikshe? Nikshe was also an online tracking or the online surveillance website for the TB patients. And this year's the same Nikust. You can understand this is also by the two Hindi names. This is also made by the two Hindi name. Ni is the different, Kust is the different, right? So Ni is the for the eradication. What is the meaning of this Nikust? This is giving us the name of as a Hindi. It is giving us the meaning of the there is a eradication of the leprosy, right? Leprosy. So this is the two Hindi names are given here. Yes, so what is this Nicost? Yes, this Nicost is your ICT based online tracking and the surveillance system for the leprosy patient in NLEP. So this is Nicost is under coming into your National Leprosy Elimination Program only, but this is just an online tracking and the surveillance system program, right? Understand? So this is the online based program. If we're talking about this multi-drug treatment regimen, if we're talking about this multi-drug treatment or multi-drug therapy regimens, what are this multi-drug therapy regimens? So we have the pockybacillary adult blister pack, and we have the multi-bacillary adult blister pack. So we, as you already know by your knowledge of your leprosy, this is the two type of the division of this leprosy, multibacillary and the pockybacillary. And this each blister pack contained the treatment for the 4 weeks, right? So this is one blister pack is covering your all of your 4 week, right? So what is the treatment is here in this going on? So once a month, right? Day one should be started from here, and the 2 capsules of the rifampicin will be here provided, which is a 300 mg multiplied by 2 as we are giving, and the 1 tablet of the dapsone 100 mg should be given from here. And if we're talking about a once a day from the day 2 to day 28, what we are giving? Yes, we are giving just only and only 1 tablet of the dapsone, which is the 100 mg. The full course is the 6 blister packs in the pockybacillary leprosy. If we're talking about the multibacillary, so in this there is a once a month which is on the day one. What is the giving on the day one? We are giving the 2 capsules of the rifampicin, which is again the same, your 300 mg. The two tablets should be given, so total 600 mg rifampicin given on the day one, and the 3 capsules of the clofazimine, which is your 100 mg capsule. So totally the 300 mg clofazimine should be given, and the 1 tablet of the dapsone 100 mg should be given. So this is the day, this is the treatment should be given on the day one. Day one. After this given the day one, from the day 2 to the day 28, what will be gonna given? Yes, there will be given of the one capsule of clozapamine, which is your 50 mg, and the one tablet of the 100 mg dapsone. 100 mg dapsone should be given, and the full course of this should be 12 blister pack should be given in the multi-bacillary. So in the pocky-bacillary, 6 blisters. In the pocky-bacillary, we are not using the clofazimine. In the multi-bacillary we are using the clofazimine also, right? So the duration of this, if we're comparing the duration, yes, in the pocky-bacillary 6 months the duration. In the multi-bacillary we are using for the 12 blisters, mean for the 12 months, right? 12 months, right? It is that one each blister pack is covering the 4 weeks, of it. Talking about the next one, this is your NACO. What is the NACO? Yes, National AIDS Control Organization. And this is the India's voice against the AIDS. And this is covering in under your mission Ministry of Health and Family Welfare of Government of India, coming the government of the India. And this is the red color ribbon is given for the AIDS program and this program is run into your 1987. National AIDS Control Program is run into your 1987, as there is the first case of the AIDS should be seen in India in the 1986 in the Chennai. All right, so where we see the first case of the HIV in India, yes, it is seen in your 1986, in the India in the Chennai, and then only the government started on this program in the 1987, and it is looked after by the NACO as a subunit of the MOFO government. What is this MOFO government? Yes, this is your Ministry of Health and Family Welfare, which is done by your government and your government of India, right? So this is the subunit of this. And if you're talking about there should be ART, antiretroviral therapy, initiated and the initiative of this on the CD4 count. So for the starting this ART, as we have to initiate this ART regimen. So for the starting this ART regimen, we have to initiate it respective of the CD4 count. We have to check the CD4 count of the patients. And for the screening, by the ERS battery, which is your ELISA, and the rapid sampling test for the rapid sampling test. And under this program and under this NACO program, National AIDS Control program, NAC program, what is this we done? We created a special different centers for this particular patients, and this is known as your integrated counseling and testing centers. ICTC. Yes, ICTC is for the specially a different unit or the different center where the patient is can get the counseling and the testing for the AIDS disease, for the HIV AIDS. So right. So this is all about your national national AIDS control program. So there is a national health program is there, is different the program. What is the main subunit? Yes, the subunit is your National AIDS Control Organization, right? This organization is the subunit of your health Ministry of Health and Welfare, health and family welfare, health and the family welfare, right? So please remember this red color ribbon logo also, right? So this is for your National AIDS Control Program only, right? Moving forward for the next logo, this is the logo for your Suraksha Clinic. Yes, this is clearly written in this logo only, the Suraksha Clinic, but they will gonna give you this image only. What is in this image you are seeing? There is a red color boxes there. In this, there's a plus sign is given, and please remember this dot should be in the middle of this logo. And what is this Suraksha Clinic? Yes, this Suraksha Clinic is for your sexual and the reproductive health services. This is for your sexual and the reproductive health services. All right, as the by what is the using for this STDs. I hope you studied about this STD disease, right? Sexual and transmitted diseases. So we are having in this Suraksha Clinic, we are having this SRT, sexually transmitted disease, and the reproductive transmitted diseases, kits are there. Kits are available there due to according to the syndrome, on the syndrome or the symptom will be available there. What are those kits? Yes, there are the totally 7 kits are available. The first, which is your gray kit, if the patient is having the urethral discharge and the cervicitis, will give the patient to give the kit 1, will give the patient to the kit 1. The kit 2 is your green color, if the patient is having the vaginitis, if the patient is having the vaginitis. The third is the white kit, which the patient is having the genital ulcers. Now, there's the difference between the genital ulcers. There is the 3 kits are here. You can see white, blue, and red. We'll talk about with this also in the brief. If the genital ulcer are the non-painful, then second one is about the painful, and the third one about the herpes, right? About the related to your herpes, right? Herpes genital ulcers. The last, which is the yellow in the patient is having the lower abdominal pain is also presented there, and the last one is the black when the patient is having this scrotal swelling, when the patient is having the scrotal swelling. So this special kits are available in your Suraksha clinic, and the patient is getting from there, right? So this is for the sexual and the reproductive health services. This is coming under your sexual and the reproductive health services, right? Moving forward, for the next is your Mission Indradhanush. Talking about this next, this is your Mission Indradhanush, and what we are having in this Mission Indradhanush, what is the important of this Mission Indradhanush? You can see by the logo only, you are seeing what you are seeing, the Indradhanush, it means your rainbow, right? What is the meaning of Indradhanush? Yes, this is the Hindi meaning of the rainbow, right? Hindi meaning of the rainbow. And you can see there's all the 7 colors are given and written the clearly Mission Indradhanush. With this, you are seeing in here, the child is here with the syringe and the needle. When the syringe and the needle, and clearly mentioned, be wise, get your child fully immunized, right? Fully immunized. So this is about this Mission Indradhanush is a run about for the your immunization of the child, and for the immunization of the child, and it's going to include it's included 100% of the coverage for the 11 vaccine. This is having the including the 100% of the coverage for the 11 vaccine, which will be the preventable disease by the 2022 to the catch up by the campings, to do it. And what are the diseases which is covered? What are the immunization vaccines which are covered in under this your Mission Indradhanush? Yes, this is covered your TB, polio, diphtheria, pertussis, tetanus, hepatitis B, measles, rotavirus, mumps, rubella, injectable polio vaccine, and the Japanese encephalitis. This all immunization, this all the 11 vaccines are covered under this in the Mission Indradhanush, right? In this under Mission Indradhanush. By the logo, you can see the rainbow is on the one side and clearly mentioned this Mission Indradhanush. The second is your child, one small child, one infant is there and having a syringe in the hand, and this is clearly written that get your child, be wise, get your child fully immunized. So this is your Mission Indradhanush. Then next we have the switch, very important. The logo is very important. By the logo, what we are seeing, the switch is here. By the switch, the first we are seeing, this is the your National Switch Day of India is on the 25th April of the 2016, right? The 25th of the April 2016. And the switch, what is the mean of this switch? The switch is known as your, this is the from of the trivalent OPV, that there was a trivalent 1, 2, and 3 trivalent oral polio vaccine was there earlier, and it was done now for the to the bivalent OPV, which is your P1 and the P3 only. So you can see this is the trivalent OPV. This is the trivalent oral polio vaccine. 1, 2, 3 is clearly written. This all the P1, P2, and P3 polio 1, 2, and 3 all are there. But on the day of the 25th, 2016, 25th April 2016, what is done? It is done as the bivalent oral polio vaccine, bivalent oral polio vaccine. And in this, we have only and only P1 and the P3, P1 and the P3, right? So you have to remember this logo. This is especially for your oral polio vaccine, for the your oral polio vaccine, right? So this is the, by the name only you can understand. So it's switch from the trivalent to the bivalent. So this is known as the word, this is known as the switch. And the national switch day, please remember, what is the national switch day? Yes, 25th April, 25th of the April in India, right? And please remember, from the trivalent, in the trivalent we was having the P1, P2 and P3, all kind of the polio, polio 1, polio 2, polio 3 was there. But in nowadays we are using the bivalent, and this bivalent we are using only and only polio 1 and polio 3, polio 1 and the polio 3. The next, the next thing is your vaccine while monitor. And this vaccine while monitor is also known as your VVM, vaccine while monitor, VVM. What is this vaccine while monitor? Yes, so every vaccine is having on the label or on the cap of the vaccine, they are having a vaccine while monitor. And what is the use of this vaccine while monitor? We have to check this, is this vaccine is getting damaged by the sunlight or by the temperature, right? If it is getting damaged, it is not used, it is not used. So for capturing this vaccine vial, is for the monitoring it, we have this vaccine vial. You can see here this one, can you see this, the round shape is here. So in this round shape, what I'm seeing, the outer is the round shape and the inner we have a one square is there. So if this square is the lighter than you can see this outer one is the gray and the inner one is the white. So it started as this white. So this is your stage one of this vaccine while monitor, or the stage one of the VBM. And this, in this we can good the, what is the mean of it? Yes, the vaccine is good and we can utilize this vaccine. The second stage, yes, in the second stage, what is happening? This color, the gray, this white color box with this white color square box is getting changed the color near to the gray. But please remember, this is lighter than the outer gray. This is the lighter than the outer gray. As this is lighter, as the central square is the lighter than the surrounding circle, we can understand that this is the vaccine is good and we can utilize this vaccine also, but please understand, if this square is getting more darker than the outer circle, if this square is getting more darker, you can see the stage 3 and the stage 4, you are seeing the same thing, that this an inner square is getting darker, dark gray, or the near the similar, it is the similar color to the outer one, or the more darker like a black, yes or no? So this is the more darker than the outer circle. So in this condition, this is the vaccine is getting heat exposure, and this is not utilized, please understand. So the central square is the equal to the same outer color or the darker than the surrounding circle. So in this condition we are not using. So please understand, in the VVM, stage 1 should be used, V1, V2 should be used, V3 and the V4 should be discarded. All right, so this is about your vaccine while monitor, about the vaccine while monitor, VVM. Moving forward, for the next is about the cold chain for vaccine. Cold chain for the vaccine. And what you are understanding by the mean of this cold chain? Yes, as our vaccines are going to produce in a mass, in a big group, in a on a factory, right? After of the production of this vaccines, after this production of this vaccine from the productory side to the distributor side, we have to maintain the temperature of this vaccine. We have to maintain this temperature of this vaccine. So for the starting the production, from the production of this vaccine, we have to carry till to the distribution side, and we have to maintain this vaccine temperature. For the maintaining this vaccine temperature, we have this chain is known as your cold chain. This chain is known as your cold chain. So in the cold chain, we are having the ice lined refrigerators. The first thing, ILR, ice lined refrigerator, which is located at your PSCs, What is this? It's located at your PSS. If you're talking about the temperature of it, yes, the temperature of this ice lined refrigerator, it is here from 2 to 8 degrees Celsius, from the 2 to 8 degrees Celsius. And what we are using it, why we are using it? Yes, we are using it for the storage of the vaccine, storage of the vaccine. We are using it for the storages of the vaccines. And from this ice lined refrigerator, we have to use the temperature recorded should be twice a day. For this checking this temperature, is the maintained or not. So what is the ideal temperature? Yeah, from the 2 to 8 degrees should be the temperature of this ice lined refrigerator. For the checking this or the getting this, that this is working normally or not, for the getting the temperature, we have the dial thermometer, which is used in the deep freezer or in the ILR, in the deep freezer or your ice line refrigerator for the cold chain. Can you see? This is the dial. This is your dial thermometer. So we put this dial thermometer inside this refrigerator, and we'll get this temperature should be recorded twice. Temperature should be recorded twice of this, twice a day from this. Also, we have the dial thermometer and we are having the alcohol stem thermometer. All right, you can see by the image also. This one is your alcohol stem thermometer, which is shown in the image, right? And this is also used. This is also used the same only. We will put this alcohol stem thermometer inside this ice line refrigerator, and we'll get the temperature inside this ice line refrigerator, right? Moving forward, for the next, we have the cold chain vaccine. What is the for the cold chain vaccine? Yes, we have the more different things. What are these different things? The first one, which is the base, is your ice pack. What is this? This is the base of your cold chain. This is the minor base of the cold chain. And what is this? Yes, this is your ice pack. And you can see in this ice pack, we are having the space of capturing the or putting the two vaccines. We are putting into the two vaccine. This is the smallest component. Please remember, this is the smallest component of your cold chain, smallest component of the cold chain. And please remember, the two vaccine vial should be capped into this. One should be here, the second should be kept here. So this is the two vaccine should be here. And where we use this? Yes, this will be used at the sub center or the village, right? And please remember, it is having the maximum failure chances. This is the ice packs is having the maximum failure chances, because this ice will be getting easily melting through the temperature. It is not covered by the anything. So there is a very big differentiation between this temperature should be decreasing suddenly or increasing will be there. So there will be the failure should be seen maximum at the ice pack. The although we have this vaccine carrier, although we have this vaccine carrier, you can see this box, right? You can see this box, and what you are seeing in this box, yes, this box is lined by the four ice packs. Yes, can you see here? This is covered by the lined by the four ice pack should be here. And as it is covered by the four ice packs, we have the space between it. In this space, we can cap 16 to 20 vaccine while should be carried this. And the same, this is also used at the sub center and the village, sub center at the village, right? So this is about your vaccine carrier. So the ice pack is the smallest unit of your cold chain, and then we have the vaccine carrier. So in the ice pack, we can keep two vaccine vial. In the vaccine carrier, we have the four ice packs should be lined in this, and we keep the 16 to 20 vaccine vial. Right. The next is program is known as your National Program of Controlling of Blindness and the Visual Impairment, which is also known as your NPCB V and PCBV. This is the program's name. This is the program name. National Program for Control of Blindness and the Visual Impairment. By the name only, you can understand. In the logo, you are seeing the red color plus is there, and clearly eye is shown. The eye is shown. So that's why this is related to your eye. It is related to your blindness and the visual impairment. So with this, And what is the mean of the blindness is here. What the mean of the blindness in the if the patient is having vision less than 3 by 60 in the best eye with the best possible correction, the patient is now the blindness. And if we're talking about the what is the most common cause of what is the most common cause of blindness, yes, that should be your cataract, and then should be your refractive errors. The most common is your cataract in the adult. If we're talking about the child, what about your child? Yes, that will be your vitamin A deficiency. Yes, it will be your vitamin A deficiency. If we're talking about the adult, yes, that should be your most common cause is your cataract. Most common cause is your cataract. All right. Moving forward for the next, moving forward for the next is they're having this special program which is known as your Vision 2020 India. So there the two programs are different. The one is the Vision 2020 by the WHO. The second one we are having the Vision 2020 by the India. And what is this? The main target of this program, the program target is the right to sight initiative. What is the mean? Right to sight should be the initiative will be here. To what is the mean? What is the main aim of this program? This the aim of this program to eliminate all the causes of the avoidable blindness. All the causes of the avoidable blindness. What kind of this? Yes, what of kind of this? There should be the cataract, right? And the childhood blindness, trachoma, diabetic retinopathy, glaucoma, and the corneal blindness. It is all are covered. This all are covered in this, right? And if we're talking about this important feature, we had created this different level of this programs. So what are those different years? What are those? The first is the vision center. After this vision center is coming under your service center, and the service center should be covered into your in the training center. And about this training center, we have the center of excellence and the apex of this program. So as this is started from the apex, then we have the center of the excellence, then training center, then service center, and the last is your vision center. And for the running this program in the school, there should be the one teacher should be more than one teacher should be available for the 150 student for the 150 student. What is the referral of this from the school to the this vision center for the child? If the child is having vision less than 6 by 9, if the child is having vision less than 6 by 9, the referral of this child from the school to vision center to the school to the vision center. Moving forward for the next one, this program is known as your Anemia Mukt Bharat 2018. Anemia Mukt Bharat 2018. What is this by the mean of this Anemia Mukt Bharat? There should be reduced the prevalence of this anemia by the 3% every year by the 2022. And there's the strategies. What are the strategies of this program, this Anemia Mukt Bharat program? What are the strategies? Yes, the strategies here, there should be the 6 benefits, 6 interventions, and the 6 institutional mechanisms. And by the logo you can see there's a drop of blood, and they clearly mentioned the name of this program, Anemia Mukt Bharat. So by the name and the logo you will understand about this program, Anemia Mukt Bharat program, right? Moving forward for the next one, this program is known as National Program of Prevention and Control of Diabetes and the Cardiovascular Diseases and the stroke, right? So this is about your national program of the prevention and the control of diabetes diabetes and cardiovascular diseases and the stroke, right? So this is known as your NPCDCS. In this program, this is a health promotion program. This is the comprised of the screening, referral, diagnostic, and the management of the non-communicable disease, non-communicable diseases, right? And by the logo you can understand, there is the health in your hand, आपकी सेहत आपके हाथ, and the name of this particular program is written, and this you can see the every there's the one person, the family is here, the one male, female, and the child should be here, and they are having the flower in their hand. They are having the flower in their hand, and this is about your national program of for the prevention and the control of the diabetes, cardiovascular diseases, and the stroke. Right. Moving forward for the next one, which is known as your rule of half. What is the rule of half? Yes, the rule of half is shown by your hypertension. This rule of half is shown by the hypertension. As the hypertension in the community, this is showing the rule of half. What is the rule of half? Please understand very well. As you can see, there is the whole community is there. The whole community is the 50%, or you can say the half of this community is having the hypertension subjectively, and as the patient is having the half of the community is having the hypertension subjectively, from this hypertensive subjectively, there is a 50% of the half of this community is getting diagnosed the hypertension, getting the diagnosis of the hypertension. As we are having the diagnosed hypertension community, this diagnosed hypertension community is having just 50% of the half of it's only getting the diagnosis and the treated, and out of this diagnosis and the treated, the half of the community is getting the adequately treated. So this is the going half and the half of this community. So as the hypertension is following this rule of half, as this hypertension is following this rule of half, you can see here the whole community is there, half of this community is having the hypertensive subjectives. Out of this hypertensive subjectives, the half of the community is having the diagnosed hypertension, and half of out of this diagnosed hypertensive community, the half of it's getting the diagnosed and the treated, and out of this diagnosed and the treatment person, the half of only is getting the adequate treated. So this is about the rule of half, and you have to remember the hypertension is following us, our rule of half is following by this hypertension. The next two is very important, as we talked about this red color cross ribbon that was about for the AIDS and the HIV, and this pink color one is for your breast cancer awareness. This pink one is for your breast cancer awareness. This is for the breast cancer awareness. If we're talking about the next logo, this blue color round logo, this is the logo for your diabetes. This is the logo for your diabetes, right? And this is the breast cancer awareness logo, and this is the your diabetes logo. This is the your diabetes logo. Talking about the next program, in this next program, what we are having, we have the National Iodine Deficiency Disorder Control Program, which is known as your NIDCP. NIDDCP. This is run into your 1992. And what is the use of this? What is the use of this National Iodine Deficiency Disorder Control Program? There is the salt ionization. What we did the salt ionization. By this doing this salt ionization, we get the 30 ppm at the productive level. We have the 30 ppm of the ionization at the production level, and there should be the 15 ppm should be getting the ionization of the 15 ppm at the customer level or the consumer level. When the patient is, or when the we are consuming this salt, there should be the 15 ppm should be there, ionization iodine be there. And you can see this is the logo. This is the logo of this program. You can see this yellow color patch will be there, and they mentioned the sun here and written iodine namak. By the, you can see by your, all of you are using the salts you are using in your house. You can go and check in the pack of your salt. You will clearly see this. You can clearly see this logo on it. You can see this clearly, or the logo of it. And this is the clearly mentioned Shakti or Buddhi ka Rakshak, Shakti or Buddhi ka Rakshak iodine namak, right? So this is all, this is for your iodine National Iodine Deficiency Disorders Control Program. Moving forward for the next, this is known as your Pradhan Mantri Surakshit Matrita Abhiyan, which is also known as your Suman, which is known as your Suman, which is known as your son. So the Pradhan Mantri Surakshit Matrita Abhiyan, right? And what is the saying by this? What is the saying by this particular program? This is the particular program, and Abhiyan is having the free antenatal care checkups on the 9th of every month. 9th of every month. And yes, this is also run by your Ministry of Health and Family Welfare, which is run by your Ministry of Health and Family Welfare of the Government of India, right? So this is also run by the same only. This is also run by your same only. And the logo only you can see, by the logo only you can see there is a mother is here, a pregnant mother should be here, and this is the two hands which is carrying on it, and this is given the name of this Pradhan Mantri Surakshit Matrita, right? And they given the slogan 9th of every month. So this Suman is carried on the 9th of every month. They are giving the free antenatal care checkups. They are giving the free antenatal care checkups. Moving forward for the next, some important logos which you have to remember for your exam. What are those logo? There should be the logo like that, which is your baby friendly hospital. This is the logo for the baby friendly hospital. The next we are seeing here, you can see this is your INAP. What is the INAP? Yes, this is the Indian Newborn Action Plan. This is the Indian Newborn Action Plan. Newborn Action. You can see the newborn is sleeping here, right? So this is the Indian Newborn Action Plan. Then next we are having the National Health Insurance Scheme, which is your RSB, which is your RSBY, which is your Rashtriya Swasthya Bima Yojana, Rashtriya Swasthya Bima Yojana, right? So this is the logo of that. And the last one, which is your National Tobacco Control Program, right? This National Tobacco Control Program, this is the given the two finger, between this two finger, there is a avoiding the cigarettes, they put it the flower here, they put it the flower here, and they given the slogan of this particular control program, which is the National Tobacco Control Program. They given the slogan of it. The slogan is given as a Jindagi Chuno Tambaku Nahi. Jindagi Chuno Tambaku Nahi. Right? So there's four important logos which you have to remember. It. The next we have the Arogya Setu app. Next we have guys Arogya Setu app. And I hope you remember this app. This app is run and used in the against the COVID-19. Against the COVID-19. By the logo, you can see there is a heart is there and the green signature mark is given here. And given the name of the app is the Arogya Setu. Arogya Setu. This is the Hindi name. Arogya, it means the healthy. Arogya means healthy. Setu, it means a bridge, right? So this is making a bridge, right? And the slogan of this particular program, this particular app is the Main Surakshit, Hum Surakshit, Bharat Surakshit. Main Surakshit, Hum Surakshit, Bharat Surakshit. And what is the use of this app? This Arogya Setu is a mobile application which is developed by the government of India to control the essential health services with the people who in the India who are has a who has the combined fighting against the and against the COVID-19 against the COVID-19. So this app is against to be used in the COVID against the COVID-19. The next the next program is here your employee state insurance, which is act is from the 1940, from the act from the 1940s, and the logo you can see this is your ESIC logo, Samajik Suraksha, social security, and this is under this is covered by the this is coming under the Ministry of Labor of Government of India. It's coming into your Ministry of the Labor. What is the contribution? Yes, if we're talking about the contribution, this contribution is very important. They are asking you question for about the contribution. If they're asking about the competition, the contribution will be the employer. There's the employer should be given the 3.25 percent of the weightage should be given by this person. And if we're talking about the employee, if the talking about the employee, so employee should be giving the wages of 0.75%. So the totally, if we are totaling of it, yes, the total should be the 4% of the wages. 4% of the wages should be the totally. Out of this 4%, how it is divided? Yes, 3.25% should be your by the employers, by the employer, right, by the company, and the 0.75 wages should be paid by your employee, by your employee. And what we are getting in this, yes, we are getting in this, there is a sickness benefit should be up to the 91 days, and in this 91 days is the employee will be get the 70% of the wages. The employee will be getting the 70% of the wages. There will be the extended sickness benefit, which is up to your 2 years. In this condition, the patient will be getting, or the this person should be getting the 80% of the wages. The patient should be getting the 80% of the wages, right? So the sickness benefit, in the sickness, how much? Yes, in the sickness, there is a, in the sickness, what is this? There is a, how much wages? There is the wages, the 91 days. We can take the 91 days for the 70% of the wages, for the 70% of the wages. If we're talking about, the extended, if we're talking about the extended sickness benefit, yes, it should be for the 2 years, for the 2 years, for the 80% wages. And if we're talking about the maternity benefit, it's the maternity benefit for the 26 weeks, and here the patient and the mother or the female should be getting the 100% of the wages. The patient should be getting the 100% of the wages, right? So this is the all about your ESIC. This is all about your ESIC, right? I hope you understand about it. Yes. Should we move forward? Yes. Moving forward for the next thing. Moving forward for the next one, in this, just a minute, in this next one, we are having the National Rural Employment Guarantee Act 2005, which is known as NREGA, right? So what is the meaning of the NREGA? Yes, what is the meaning of the full form of the NREGA? National Rural Employment Guarantee Act. And this is came into year 2005. What is the guarantee of this? Yes, what is the guarantee of it? It is giving the more than 100 days of employment per year. It is providing the employment in the rural area to the person more than 100 days of the employment per year, and there is a maximum one person from the one BPL family. They are taking the maximum one person from the one BPL family, and there should be the unskilled manual labor. What is done in this program? Yes, there will be done the unskilled. There is no need of the skills, right? So they are doing the unskilled manual labor should be done. So you can see by this image, by the manual labor, you can see they are working in a field or farmer, and 100 in the logo only they mentioned this 100. It means there should be the guaranteed more than 100, more than 100 days of the employment per year should be given in the program of NREGA. And right, so the Hindi name of this NREGA program is the Rashtriya Gramin Rozgar Guarantee Adhiniyam, right? So this is about your NREGA. This is all about your NREGA. Moving forward for the next, this is about your IDSP. What is your IDSP? Integrated Disease Surveillance Project. Integrated Disease Surveillance Project. And in this Integrated Disease Surveillance Project, what we are having? We are having the encompass regular and salinity of the periodic surveillance. Like this is a form of syndromic diagnosis, and there is a pre-surveillance diagnosis of the lab confirmed diagnosis. So you can see by this only. So this is the integrated. 3 persons are here. They all are the integrated. This is for the integrated disease surveillance project, right? Moving forward for the next one, this is about your national. This is about your national, your NDRF, right? So in this NDRF, there is a National Disease Response Force is there, and it is under the National Disease Management. This is coming into your National Disaster Response Force. Who is the chairperson? Yes, the chairperson is our Prime Minister. Chairperson is our Prime Minister. Other than this, there is a nodal ministry also. Who is the nodal ministry? Yes, Home Affairs should be a nodal ministry. If we're talking about the nodal center of this National Disaster Response Force, so it will be at the district level, So you can see that by the image, there's a triangle between it, and we have the circular logos, and clearly written National Disaster Response Force, Aapda Seva Sadev, and the World Disaster Reduction Day is on the your 13th of the October. It's celebrated in the your 13th of the October, right? So this is about your National Disaster Response Force. National Disaster Response Force. Moving forward, for the next is your disaster management cycle. Talking about this disaster management cycle, what is we are seeing in this disaster management cycle? Yes, there is the health and the medical relief. There is the health and the medical relief. What is the mean? There is the primary phase of it. Please understand. There is a primary phase of it, of the disaster management cycle. This primary phase is from the 0 to 6 hour, from the your 0 to 6 hour after the disaster. And in this, there should be the, what is the important thing is there? Yes, there is the first aid and the medical care should be get by this patient in this in this primary phase. Then we have the secondary phase. In the we are having the secondary phase. This secondary phase is saying that there should be, this is from the 6 to 24 hour, there should be the transportation, sanitization, and the immunization should be done in this particular disaster management cycle. And then we have the tertiary cleanup. What is the meaning of tertiary cleanup? There should be provided the food, clothing, shelter, social services, and the rehabilitation should be done. So this is about your cycle. So as the disaster will be there, please understand, after this disaster, there should be the response by the patient from this NDRF. There should be the recovery, migration, and the preparedness. So should be all over. This is known as the disaster management cycle. There are the three phases of this cycle. Please remember: primary phase, secondary phase, and the tertiary cleanup phase. Tertiary cleanup phase. So this is the important for these three phases. The next we have the Pradhan Mantri Jan Dhan Yojana. Pradhan Mantri Jan Dhan Yojana, PMDJ. Please don't compare with the Pradhan Mantri Arogya Yojana, right? PMJ. PMJ was different. JAY was different. Pradhan Mantri Jan Dhan Yojana. Jan Arogya Yojana is different. Jan Dhan Yojana is different. In this Jan Dhan Yojana, there should be a given the Mera Khata Bhagya Vidata, and this is under by the Ministry of Finance in the Government of India. Government of India. And this is of your, this is for your Pradhan Mantri Jan Dhan Yojana. Pradhan Mantri Jan Dhan Yojana. The next we have the UIDAI Aadhaar, right? UIDAI Aadhaar. I hope everyone is having nowadays Aadhaar. So this is the logo of your Aadhaar. This is the logo of your Aadhaar card or the Aadhaar, for the Aadhaar. Moving next, there's the name of this particular mission is your Ujala. And what is the meaning of Ujala? Yes, the Ujala, it means in the Hindi word, which is the light up, right? And this full name of this, there is the Unnati Jyoti by Affordable LEDs for All. This is known as your Ujala, Ujala. And this is the ministry by, this is done by the Ministry of Power of the Government of India. And what is the main target of doing this Ujala, Unnati Jyoti by Affordable LED for All? In this Ujala is the target to distribution of LEDs at the affordable at the subsidized prices, right? So it's provided the LED bulbs. This provided the LEDs bulbs to the families in the India for the affordable and the subsidized prices. And by the logo only you can understand there's the LED bulb is given in the logo and clearly written the Ujala, Ujala. All right, please remember this is the Ujala. After the Ujala, we have the Ujjwala. Ujjwala. What is the meaning of? Yes, this is about the Pradhan Mantri Ujjwala Yojana. PMUJ. Ujjwala, it means the light up. What do you mean by the Ujjwala? Ujjwala, it means the light up. and this is done by the Ministry of the Petroleum and the Natural Gas of the Government of India. By the logo, you can see there is the gas cylinder is given in the logo, and clearly written the Pradhan Mantri Ujawala Yojana is given you. And you can see on this logo of the cylinder, you can see this is the getting light up. The fire is getting light up should be given is there. And what is the main aim of this? The main aim of this Yojana is the free LPG connection. The main aim of this Yojana is the giving the free LPG connection to the BPL families, and the giving the gas cylinders at the subsidized rates, and give the gas cylinders at the subsidized rates. And this is about your Ujjwala. So we started, we talked about the Ujala, it's for the LED provider. Then we talked about the Ujjwala, right? This Ujjwala, it means you're providing your gas cylinders and the LPG connection. And then we have the Ujawala Yojana. Please understand this is the three words which is the looking similar and the pronouncing similar, but both three are the different program. And this is coming the Ministry of Women and the Child Development. This is coming into the under your Women and the Child Development, and this is the comprehensive scheme to the prevention of trafficking and the rescue and the rehabilitation and the reintegration of the victims of trafficking and the commercial sexual exploitation, right? So this is run by your woman Ministry of Women and the Child Development, government of India, the government of India, right? So this is about the comprehensive scheme to the prevention, the trafficking and the rescue of it. And this is known as Ujawala. Please understand, two J are here, two J's are given here, Ujawala. And talking about this Ujwala, yes, two J's are here, but there should be not this, not this A. This A is extra here. Just remember with the A, so it will be easy to remember. There is an extra A. Ujawala, right? So this Ujawala Yojana is for the trafficking, right? And this Ujwala, there is a no A, right? There is a no A is given. So this A is missing here. This is about the LPG gases. This is about your for the LPG gases one. Okay, right? I hope you understand this. I hope you understand this. Right? Should we move forward? Should we move forward? Oh, very good. The next logo you are seeing on your screen, this is known as your, this is known as your Beti Bachao, Beti Padhao Abhiyan. This is known as your Beti Bachao, Beti Padhao, Beti Bachao, Beti Padhao Abhiyan. And you can understand by the logo only, you can see there is a, there is a clearly given the image of a child, female child, right? And clearly written the logo Beti Bachao, Beti Padhao. And although the second logo, this is about the Beti Bachao Beti Padhao Abhiyan, and this is also, this is also by your, this is also by your Ministry of Women and Child Development. This is also by your Women and the Child Development Mission Ministry. Although we have one more logo, which is the Beti Bachao, which is about the Save the Girl Child, which is about the Save the Girl Child, about the infantile mortality, right? So this you can see, this you can see by the, that this is for the Beti Bachao. There is also the one girl is there in the logo, and this is for the Beti Bachao, Save the Girl Child. On other hand, we are seeing the Save the Girl Child, Beti Bachao, also the Save Beti Padhao, right? Both are in this logo. You can see she is reading the book, so this is about the Beti Padhao, right? So this is the logo of Beti Bachao and Beti Padhao. Moving next, this is about your Ayush. This is about the your Ayush, and this is the department. What is the full form of this Ayush? This is the Department of Ayurveda, Yoga, Naturopathy, Unani, Siddha, and Homeopathy. And this is also coming under your Ministry of Health. This is the Ministry of Health and Family Welfare coming under your Ministry of health and family welfare, about the government of India. And this logo you can see, this is the Ayush Vibhag, this is the Ayush Vibhag. There is the written and the clearly written Sarve Santu Niramaya. This is the Sanskrit logo which is written for the, this is written for the healthy person, right? For the healthy person. And this is about the Ayush. Please remember Ayush. What is the meaning of Ayush? Yes, A is for the Ayurveda, Y is for the yoga, N is for the naturopathy, and U is for the Unani, and S is for the Siddha. S is for the Siddha. All right. So this is all about your Ayush Vibhag. This is all about your Ayush, right? Okay. We are moving forward for the next. We are moving forward for the next. We have the logo of National Day of Yoga, and this is coming into your yoga of harmony and the praise. And when we are celebrating the National Day of Yoga, yes, it is on the 21st of June. This is on the your 21st of the June, right? This is on your 21st of the June. Clear? So this is on your 21st of the June. This is about the International Day of Yoga. International Day of Yoga. The next images, you are seeing the logos, important logos. What are those important logos? Yes, the important logo, these important logos are for the Indian Standard Institution. What is the use of it? Yes, what is the use of it in this, where we are using for the ISI mark. This is the ISI mark, and this ISI mark is having for the standard the compliance in the mark of industrial product of India since the 1955. Since the 1955, we are running this ISI mark, and this ISI mark is the for the standard for the compliance, standard for the compliance mark of the industry product, right? So this is your ISI mark, right? ISI, it's a Indian Standard Institution, Indian Standards Institution. Then next we have the FSI. What is the meaning of this full form of the FSI, right? This is the Food Safety Standard Authority of India. Food Safety Standard Authority of the India, and this FSI is the responsible for the protecting the and the promoting the public health through the regulation and the supervision of the food safety. So the importance of this FSI is for the food safety, for the food safety. Then we have one more logo about, this is known as your ag mark. This AgMarks is the certification mark of the employed on the agriculture products, on the agriculture products in India. So the ISI mark on the industrial product, FSI is on your FSI is on your food product, and the AgMark is on your agriculture product, which is the assuming that is the confirmed to set on the standard. If the product which is the coming into your market, this is on the standard of the standard, on the confirming on the standard, right? And then last we are having the Bureau of Indian Standard, which is known as Manak Production, BSI, Bureau of Indian Standard. This is for the national standard body of the Indian established under the Act of 2016 for the harmonious development of the activities and the standardization of the making and the quality of the certification of the good and the matter concerned. There should be the incidental trial should be given. So this is for the Bureau of Indian Standards. So you have to remember this, all the four logos, the Indian Standard Institutions, ISI. Then we have the Food Safety and Standard Authority of India, FSI. And then we have the AgMark, and we have the Bureau of Indian Standards, right? So these four important logos are here. Moving forward for the next one, we have the Edward Jenner, and we have the James Lind. The James Lind is he worked on the scurvy and the naval hygiene. It's worked on the scurvy and the naval hygiene. Although we have the Edward Jenner, this Edward Jenner is coined the term vaccination, and also he developed the first vaccine for the smallpox. The first vaccine for the smallpox. So you have to remember this image about the James Lind and about the Edward Jenner also, about the Edward Jenner also. Then we have the important image of the Sir Louis Pasteur, of the Sir Louis Pasteur. And for this, you have to remember too many things, as this is the known as the father of microbiology. This is known as your father of microbiology, and he was a French microbiologist. He was a French microbiologist, and he invented a vaccine of cholera, anthrax, and the rabies. He given the invented the vaccine of the cholera, anthrax, and the rabies. So he given the three vaccine of this. Also, he also invented the pasteurization. He also invented the pasteurization. He also invented the pasteurization. So too many things you have to remember about the Sir Louis Pasteur, father of microbiology. Given the vaccine, three vaccines should be given: cholera, anthrax, and the rabies. And he also invented the pasteurization. He disapproved the theory of the spontaneous generation of the disease by the astrals. He given the disapproved of the theory of this, and then he given the germ theory of the disease, and then he given the germ theory of the disease. So you have to remember all about the Sir Louis Pasteur, Sir Louis Pasteur. And then we have the John Snow. Then we have the John Snow. What is the importance about this Sir John Snow? This is the father of epidemiology. This is the father of epidemiology, and although then further it is known as the father of modern epidemiology also. In the starting, he known as the father of epidemiology, and in the later, he also known as the father of modern epidemiology. And he worked on the cholera, and therefore the cholera is regarded as the father of public health. Then the cholera is regarded as the father of public health. And the national, and this is the national institution of the epidemiology, Chennai, India. And where we have this national institute of the epidemiology in our India, we have in the Chennai. India, we have in the Chennai. Moving forward about the important things, we have the epidemiological triad and the epidemiological triangle. In this epidemiological triangle and the triads, we have the three things. What are those three things? The first is the host in this triad. First, we're talking about the triad. We have the host. The second, we have the environment. And the third thing, we are having the agent, right? We have the host, environment, agent. Host, environment, and agent. And if I'm talking about the triangle, in the epidemiological triangle, yes, the three things are here. The agent is there, host is there, environment is there. But the fourth thing which is added here, this is about your time. This is about your time. All right. So if the time is there, this should be known as the triangle. If time is not in this triangle, it is known as the triad. This is known as your triad. This is known as your epidemiological triad. This is known as your epidemiological triad. Moving forward for the next is this logo. By this logo, we understand this is given as the web of causation theory. This is known as your web of causation theory. And this web of causation theory is given by the McMahon and Pugh. This is given by this McMahon and the Pugh. And if we're talking about it, in the next, we have the multifractional causational therapy or causational theory also. This is given by the Peterkoff. This is given by the Peterkoff. So you can see this is the logo, and by this you can imagine that this is the web of causation, are the more factors are having on the different diseases on the working on it. And the multifactorial causation therapy, in this you can see the all are the causes will be going to affect on the effective disease. Moving forward for the next is your about your iceberg phenomena. Iceberg phenomena. By the iceberg phenomena, you can see this is the iceberg phenomena of COVID-19. This is the iceberg phenomena of the COVID-19. Whatever the visible of this tip of this iceberg, this is all are the visible and the diagnosed case of the COVID-19, and which is under the water, which is under this water level. This iceberg is there. This is your invisible cases. What do you mean by the invisible cases? Yes, those invisible cases are such the misdiagnosis cases, or there goes in the undiagnosed case, or the subclinical case, or the asymptomatic or the pre-symptomatic case, or the suspectable populations are there. Those are covering into your under this water, which is known as your invisible also, which is known as your invisible also. And this is all about given the lead time. This is all about the given about the lead time of the COVID-19. All right. Should we move forward? Yes. Then next we have the prospective cohort studies. Then we have the prospective cohort studies, and also we have the retrospective cohort studies. So what is the mean of prospective cohort studies? So we are starting this from the present as the study participants. We have the risk factor presents here, and we have the exposed person. We have the non-exposed person of this particular risk factor. Right, particular risk factor. And then in the future we have to evaluate it, what should be the outcome and what should be the not outcome from the exposed person, and what should be the outcome and there should be the no outcome from the not exposed person. So this is known as, you have to start the beginning of the study and then we'll go into the future to end this study. This is known as your prospective cohort study. And if we're talking about the retrospective, we have to go behind it, and we are starting study with the outcomes. We're starting this study from the outcomes. As we started from the outcome, we have to go behind and ask the patient, is the patient is exposed of this, having the exposed to the risk factor of this particular disease. And with this we have to measure all the co-founding of the variable of the baseline. So this is on the retro, we are going backward. So this is known as the retrospective cohort study. If you are going into the future, that is known as your prospective cohort studies. And then we have the analytic studies also. In this analytic studies also, like a case control study. What is the case control study? Yes, we are at the present time and we have to talk with the population of the event, and we have to review the history of the patient. How many of this had the exposing of like smokers, and who are the having the not exposed as the non-smokers. Like the population is the event of the example, like a lung cancer. We are taking the case of the lung cancer. Although we have then the control sample also, which is the control sample. In this there is a history, which is the example of the healthy volunteer. Out of this healthy volunteer, we are reviewing this history of also how many are having the exposed to the lung cancer and how many are having the non-exposed to this lung cancer. So this is all about the case control. We are starting with the case and go with the control. We are having the two different presentations here, case and the controls both. We have to study about this both of it. Although we have the one cross-sectional studies design. In the cross-sectional study, we are taking a sample of the population. Out of the sample of the population, we are dividing into the exposed and the non-exposed of the non-exposed of this particular section, and then we divided this exposed into the cases and the non-cases, and non-exposed into the cases and the non-cases. This is known as your cross-sectional study. This is known as your cross-sectional studies. Next we have the population distribution. We have the next is about the population distribution. Please remember the two things. In the developed countries, we are seeing the population distribution into the spindle shape, and in the developing countries we are seeing the in the pyramid shape, like your USA is your developed country. It's a already developed country. We are seeing which type of the shape? We are seeing the spindle type of spindle shaped population distribution. Although, like we're talking about the Nigeria, you can see here, Nigeria is a developing country. It's a developing country. So what we are seeing? We are seeing the pyramidal shape. We are seeing the pyramidal shape of the population distribution. Right, right. Moving forward for the next about the contraceptives. About the contraceptives. In the contraceptives, we are started with the barrier contraceptive. In the barrier contraceptive, we have the male condom, which is having the Pearl index of 2 to 14, right? And then we are having the vaginal sponge, which is also known as the Today. The Pearl index is 9 to 20, 9 to 20. Although we have the female condom, this female condom is having the Pearl index of 5 to 21, 5 to 21. And the last one is your vaginal diaphragm, which is having the Pearl index of 5 to 20, 5 to 20, right? So this is all about your barrier contraceptive. This is all about your barrier contraceptive. Although we have the intrauterine contraceptive device, although we are having the intrauterine contraceptive device, please understand this is the pearl index is very low, just 1 to 5 is there, and this is the best method of emergency contraceptive. This is the best method of emergency contraceptive, emergency contraception. What are the emergency contraceptive? What is the mean of this intrauterine device? We have the first, which is known as the Lippes loop. Please check this image. It is having a different loops are there. This is known as the first generation, which is the Lippes loop, and this is the first generation IUCD, and it is having the highest failure among the IUCDs. And this is the non-medicated and the intern. This is the non-medicated and the intern. Then we have the second generation. In the second generation, we have the copper T 380A. This is the second generation IUCDs, bioactive, and this is having the significant vertical length of the limb on the 380 significant surface of the area of the copper is used. So you can see if it is used on the arms also, it is known as the 380A, copper T 380A. And the last, the third generation, which you are seeing here, this is the Marina. This is about the Marina. This Marina is the third generation IUCD, which is the containing the levogastron medicated. This is a levogastronol medicated IUCD. This is the medicated IUCD. So this is all about your intrauterine contraceptive devices. If we're talking about the more contraception, in the contraception we have the chaya. In the contraceptive medications, we have the chaya. What is the chaya? The chaya is also known as the Saheli and the centochromin. And this is the medication will be used as the once a week pill. So the patient is using this as a contraceptive medication once a week. Although we have the next is we having the antara. And what is this antara? This is having the medroxyprogesterone injection. This is having the depomedoxyprogesterone acetate, DPMA. And this is the IM injection. We are giving the IM injectable hormonal contraceptive. We are giving this to the patient of the injectable. This is the injectable hormonal contraceptive. Although then we having the combined oral contraceptive pills, OCPs, which is known as the COPS. OCP, which is known as the COPS. Why the COPS? Yes, C is your combined oral contraceptive pills. And in this we have the two important in India, Mala N and Mala D. We have the Mala N and we having the Mala D. And there is also we are using the UPs and the laser regimen. The 4 pills taken at the time 12 hours apart within a 72 hours is used in the emergency used as the emergency contraceptive. What is having in this? Yes, we are having the ethyl estrol 30 micrograms, and we are having the levonorgestrel 150 micrograms, and there we are having the 7 ferrous sulfate 60 gram 60 mg tablets, right? And we are having the pearl index of it just 0.1 to 2 will be the pearl index of this COPS, this combined oral contraceptive pills, about this combined oral contraceptive pills. The next, it's about the sterilization. What about the sterilization? There's the two permanent method of contraceptions, which is the having the pearl index less than 0.1, less than 0.1. What are these two important sterilization? The first is your tubectomy. The first is known as your tubectomy. What does it mean? This is the most commonly used method. This is the most commonly used method. What is the tubectomy? What we are doing, this fallopian tube is cutted and the tied together. Yes, into the cutted into the two different parts and tied in the differently there. And this is the most common technique is used in this. Yes, this is your Pomeroy's technique. This is your Pomeroy's technique, and this is known as the tubectomy. Tubectomy, it means the fallopian tube should be cutted. As the fallopian tube is cutted here, this ovum should be not travel to the now into the uterus, and there is a permanent contraception. There will be a permanent method of contraception is here. Although next we having the vasectomy, and this, so what is the mean in the vasectomy? As you know, this is the vast difference is there, which is coming from the tapsis. right? So there is a vast difference is getting cutted, vast difference is getting cutted. As it is getting cutted, so there will be the no sperm will be going to travel into through the penis, right? And there will be the one advice should be given to the patient of the post vasectomy: use the barrier method for the next 3 months, for the next 3 months, or the next up to 10 ejaculations, up to the 10 ejaculations. And this is about the advice of the vasectomy. So this is the two permanent, this is the two permanent method of contraception, the two permanent method of contraception: tubectomy and the vasectomy, tubectomy and the vasectomy. Also we have the natural method of the contraceptions also. What are this natural method? These are the Billings ovarian method, Billings ovulation method, right? Billings ovulation method. This is a very simple, natural, and the although effective also. This is also effective also, right? And next we have the this is the critical pathway, which is the long pathway term of duration, and it is method is used in the network analysis in the health management. This is used in the network analysis in the health management. And this is a very important image and the last image of today's session, which is your image of the biomedical wastage. Please remember, this biomedical waste is very important. Biomedical waste is very important, and you have to remember all the beans. What are the meaning of the beans? Yes, in the yellow color, in the yellow color of the dustbin, you have to put the post, you have to put your post operative body parts or placenta, right? Plasters, POP plasters, pathological vestige, cotton vestige, dressing materials, bedding, body fluids, face masks, caps, cytotoxic, and all other things. And please remember also the importantly which they ask you in the yellow. Yes, they are asking you about the blood bag. Okay, so blood bag will be in your yellow bean only. Next we are having in the red, we are having the syringes without the needle, IV set, catheters, gloves, urine bag. Please remember the urine bag should be given into your red color dustbin, and the dialysis kit and the IV bottles. In the white color, which is the translucent one, in the white translucent one, we have to put the needle and all the sharp like syringe with the fixed needle, blade, scalpels. So all the sharps will be in your translucent white color, translucent white color bean, translucent white color bean. And we have the last, which is your blue color. What is our blue color? In this blue color, we have the broken glass, ampoules, lap slides, nails, metallic implants of the bodies, and all will be in the blue. All will be in the blue. And the last, we are having a one more dustbin will be here. That is your black color. That is your black dustbin. What will be in the black dustbin? Yes, we'll putting the all the journal waste, all the journal waste in this black one, in this black one, right? So this is all about the biomedical waste, right? I hope you like this session of the PSM important images and the national health mission. We covered the national health missions. With the missions, we covered the some important images of your PSM subject. I hope you like this session, right? If you have any queries, you can directly ask me on my Instagram. Dr. Vaibhav Ahuja is my Instagram, and although you can ask me directly on my Telegram. This is the my Instagram and my Telegram. Also, you can contact if you have any queries. You can contact this Meduhub. You can contact the Meduhub channel, and you will get your queries solved. Right. I hope you understand this all the things related to this session. Right. If you have any queries, surely. Right. So this is all about the National Health Missions chapter. Right. Thank you so much. Goodbye.